What is central post-stroke pain, CPSP, after stroke? Imagine experiencing pain that seems to come from nowhere, lingering long after a stroke. That's what central post-stroke pain is. It is a type of chronic pain that develops after a stroke and affects the same part of the body controlled by the damaged brain area. This pain is caused by injury in the central nervous system's sensory pathways, especially in structures like the thalamus, which normally help process pain and sensory signals. CPSP is considered a neuropathic pain condition, meaning it results from nerve damage within the brain or spinal cord. People with CPSP often describe sensations like burning, tingling, numbness, or sharp stabbing pains. Some also feel aching or a mix of these feelings. The pain can be constant or come and go, and its intensity can range from moderate discomfort to severe pain that interferes with daily life. One of the tricky parts about CPSP is that it can cause abnormal sensitivity to stimuli. For example, a gentle touch or cold temperature might trigger pain, even though these stimuli are normally harmless. This phenomenon is called allodynia. Sometimes, people feel pain from stimuli that shouldn't cause pain at all, which can be very distressing. Most cases of CPSP start within the first 3 to 6 months after a stroke, but in rare instances, it can develop later. The prevalence varies widely, affecting anywhere from about 8 to 55% of stroke survivors. Factors that increase the risk include younger age, more severe initial strokes, damage in sensory areas of the brain, and early abnormal sensory symptoms at the time of the stroke. Diagnosing CPSP involves ruling out other causes of pain, such as musculoskeletal problems, peripheral nerve issues, or psychological factors. Because it is a central neuropathic pain syndrome, the pain originates from the brain injury itself. Healthcare providers often use clinical assessments and imaging studies to support the diagnosis. Treating CPSP can be challenging because it often does not respond well to standard pain medications. Doctors may start with common pain relievers, but more often they turn to medications that target nerve pain, such as tricyclic antidepressants or anticonvulsants. In some cases, stronger pain medications or neuromodulation techniques like deep brain stimulation might be considered, but these are usually reserved for severe cases. Psychological support and counseling are also important, as living with chronic pain can affect mental health and overall well-being. Because CPSP can significantly impact a person's ability to recover and participate in rehabilitation, a team approach is essential. This team might include neurologists, pain specialists, rehabilitation doctors, and mental health professionals. Each individual's experience is unique, so treatment plans are tailored to meet their specific needs. In summary, central post-stroke pain is a complex condition caused by injury to the brain's sensory pathways after a stroke. It results in persistent, often distressing abnormal sensations and pain in the affected area. Managing CPSP requires careful assessment and a combination of therapies aimed at reducing pain and improving quality of life. If you or someone you know is experiencing ongoing pain after a stroke, it is important to consult healthcare professionals who can develop an appropriate, personalized treatment plan.